Latest news in Health World.
So it was the year of 2015 and it was the month of August, and I was diagnosed with endometrial cancer. It was something very new that I've never heard of. I've heard all the other type of cancers like blood cancer, breast cancer, but endometrial cancer was something very new. At that time, at that part of my life, I was only thinking that every day of my life was the last day, where I made sure to live that every day by giving my 100%. There would be even days where I used to think there wouldn't be the next morning. I would think that I'm not gonna see the next day. That was the fear, or that was the pain in my heart, where I was always feeling that I'm gonna miss all of my loved ones around me, and they're all gonna miss me one day.
Pathogenesis is whereby the development of endometrial cancer is the result of multiple genetic mutations. So the pathophysiological of endometrial cancer depends on the histological subtype. And for endometrial cancer, it forms when there are errors in normal endometrial cell growth. When we talk about the development of an endometrial hyperplasia, it is a significant factor because hyperplasia can and often do develop into adenocarcinoma, though the cancer can develop without the presence of hyperplasia. So within 10 years, 8 to 30% of atypical endometrial hyperplasia develop into cancer, whereas 1 to 3% of non-atypical hyperplasia also do so. The endometrial cancer frequently metastasizes to the ovaries and fallopian tubes when the cancer is located in the upper part of the uterus, and the cervix when the cancer is in the lower part of the uterus. So the cancer usually spreads into the myometrium and the serosa, and then into the reproductive and the pelvic structures. When the lymphatic system is involved, the pelvic lymph nodes and also the para-aortic lymph nodes are usually the first to become involved, but not in any specific pattern, unlike the cervical cancer. There are risk factors for endometrial cancer, which includes estrogen exposure, and women who have received higher doses or longer periods of estrogen therapy have higher risk of endometrial cancer. Also, women who have menstrual periods at an early age also increases the number of years the body is exposed to estrogen and increases a woman's risk of endometrial cancer. And so talking about women who have never been pregnant is also a risk factor for endometrial cancer because estrogen levels are lower during pregnancy, and women who have never been pregnant are exposed to estrogen for a longer time than women who have been pregnant. So this increases the risk of endometrial cancer. And besides, when we talk about the syndrome known as the polycystic ovary syndrome, women who have this syndrome have an increased risk of endometrial cancer. So other than that, obesity can also be one of the risk factors, and this is because obesity is related to other risk factors such as estrogen levels, polycystic ovary syndrome, lack of physical activity, and a diet that is high in saturated fats.
Once I was diagnosed with this cancer, I was continuously going to the clinics and the hospitals to make sure to know about my health condition. And as I was going, I had to undergo external pelvic radiotherapy, and also the internal radiotherapy as well. This both radiotherapy, where there would be radioactive rays beaming right into my vagina, where I would be placed in a room and I am asked not to move for about 19 hours. It was all one go. It was a very painful moment of my lifetime, where right after that there would be this burning sensation on my skin layer of my vagina, where it would be a very uncomfortable feel, and that made me to keep myself locked up in the room, and eventually I was undergoing depression on my own. And as days went on, I knew earlier that I wouldn't be able to bear a child, and so the doctors advised me to just perform hysterectomy, where they just remove the uterus out of my body. And it happened, and I was very sad that I wasn't able to bear a child. And the preventions that I took was that I wish I had done them earlier rather than me regretting right now. And I hope those who are watching this would truly understand that they should take these precautions, especially the women, where make sure I always wish that I made sure to work out. I made sure to look over my body size, my health condition without being obese, where obesity, it causes extra fat around the waist and polycystic ovary syndrome, all of these things. And I was also a person where I loved consuming soy products. Every day, I guess, I used to drink soy drinks and all these things, where they were the main cause for this estrogen fluctuation in my body, where estrogen is one of the things where it causes endometrial cancer. Throughout all of this way, I am doing good, and I'm still undergoing the therapy 3 months once. By God's grace, I would say that I'm still living as a testimony of this endometrial cancer patient.
Good morning, I'm Eshika Ellyson, and I'm the news reporter for today. Today we are at Management and Science University to know about the awareness among the students here about endometrial cancer. So, what is endometrial cancer? When the layers of cell, which is endometrium, grows uncontrollably, and this will result in tumor or also cancer. Endometrium is also known as the lining of the uterus. And as you all know, uterus is a hollow organ, a pear-shaped organ, where the baby develops. Based on the World Research Fund International, endometrial cancer is the 6th most common cancer in the world. Meanwhile, based on the WHO of the Malaysian cancer statistics, 1,401 new cases and 433 deaths are recorded back in 2020. To gain more knowledge about endometrial cancer and in-depth detail, we have invited a special guest with us today, which is also a gynecologist. Let's go and meet her. Good morning, Miss Hannah.
Good morning.
Thank you for being here with us today. So, can you tell us more about endometrial cancer and how is it similar with other cancer?
Of course. So first of all, endometrial cancer is for menopause women, but it can be occurs in young women as well. However, it is quite similar, as the symptoms could be similar to other type of cancer, would be like breast cancers or even cervical cancer, as this mostly common occurs in women. I'm sure it doesn't occur in men because they don't have any uterus. So yeah.
Oh, I see. Thank you for the great info. So as you said, there were similar symptoms. So what are the similarities and how do we differentiate the symptoms?
Alright. So first of all, in endometrial cancer, it is a cancerous cells that grows in our body. However, it will not show any symptoms, as it only occurs when the cancer cell grows in our body or it spreads to other organs, which is very dangerous for women nowadays. As the symptoms that could occur would be, the main one or the common one would be the vaginal bleeding or discharge, having a very abnormal type of amount that is going through in their body. It's very, very not good, as this usually occurs in menopause women. Obviously, menopause women, they don't go through the menstrual cycle anymore. So when you are over 50 years old and you undergo this vaginal bleeding, it should be concerned. That's why they have to go and meet the doctor and go undergo this diagnosis. But it can also occur in young women, where they can have irregular period amount, where in 1 month they could have around 2 to 3 times of menstrual cycle. So go check it out.
So for my next question, for all the women that's concerned about their health because they're showing symptoms such as vaginal bleeding or also irregular periods, what are the diagnostic tests that they can do in the hospital?
Okay, so first of all, not having vaginal bleeding can already diagnose you're having a endometrial cancer. It could be like lower back pain, or even like pain in the your legs, or even having a drastic weight loss. So better watch out with those kind of symptoms, which is very, very common. As for the diagnostic tests, there are 3 common tests that ladies can go and check it out. The first one would be Pap test. This, they will take like a few cells of your cervix or your uterus, and they will diagnose, like observe under the microscope, and to see if you have any tumors. They won't check for cancer cells, but they will check only for tumors if you have like abnormal kind of endometrium wall. So the next one would be, the main common one is transvaginal ultrasound. This is like doing some having high energy sound wave in your vagina to check on any tumors that occurs in our internal organs. And lastly would be the biopsy to check on the cancer cells. That usually is the easiest one, but it could not it could not diagnose to the early stages. For early stages, may go with the Pap test rather than the biopsy.
Okay, thank you for the in-depth detail, Miss Hannah. Thank you, Miss Hannah. So we will move on to MSc student and ask them regarding their knowledge about endometrial cancer. Hello, good morning, Miss. I'm Eshika. I'm a news reporter. What's your name?
My name is Myra.
Adam.
Joyce. Yasmin.
Hey, Miss Myra. Have you ever heard of endometrial cancer?
No. I never heard about that.
Apa tu? Tak pernah lah.
I think so. No.
So, do you think it's similar with cervical cancer?
Maybe.
No.
Yes, similar. Maybe, I think so.
Okay. Do you think endometrial cancer occurs in men or women or both?
Maybe women.
I think bunyi dia scientifically and both lah kot.
Women. Both.
So I guess we got a lot of information about endometrial cancer for today. So that's all from me, I guess. And other than that, it's very important for us women to know about our health, to care about our health, to go and have a check-up on ourselves if we have concerning symptoms, such as irregular periods, vaginal bleedings. Thank you for listening to us, and hope you guys learned something about endometrial cancer.